Hello, I'm Dr. Hamilton. I'm an interventional pain expert. I want to talk to you about medical cannabis today. Cannabis has been used for centuries in the treatment of a variety of medical conditions. The first reported cases was approximately 500 years before Christ. Cannabis, like a lot of other chemicals, works at the nerve ending sites, and these are various pictures of types of nerve endings. I know that this is a controversial subject. It's controversial because of political overtones, because of religious overtones, but that's not my interest today. My interest today is to talk about cannabis and its uses from a medical perspective. Plants have been used in medicine over the centuries. There are over 100 different types of medications at this time used across the United States and the world in the treatment of medical type conditions. Cannabis works through what's called the endocannabinoid system. It essentially blocks transmitters that sense pain or other conditions. This diagram shows a nerve ending. There's little packets of nerve transmitters that move from one end of a nerve receptor to the other side of a nerve receptor, and cannabis basically reduces the transmission of these little packets of nerve transmitters across the synapse or the nerve receptor. Let me talk about one plant that has been used since the 1800s in the treatment of pain. It's poppies. From poppies, we get morphine, which can be converted to oxycodone, which can be converted to hydrocodone, and it's used in the treatment of severe pain, the moderate pain, and sometimes mild pain. We commonly use morphine in the treatment of pain. We use it in surgery, but morphine, which can be converted to heroin, can have a harmful effect when people become addicted to it. So you can see that there's a very beneficial effect of morphine and its byproducts, or a harmful effect if used improperly. Cannabis basically is composed of two components, THC and CBD. THC is the psychoactive component and CBD is the non-psychoactive component. CBD oil is used across the United States and is legal in all states, and CBD can contain a small amount of THC, the psychoactive component, but it's legislated in each state independently. THC, which is a psychoactive component, is legal in many states, and Missouri is one of the newest states to enact a cannabis law. Cannabis can be used in the treatment of pain, which can be caused by arthritis, menstrual type disorders, headaches, shingles, insomnia, post-traumatic stress disorder, AIDS, ALS, fibromyalgia, Parkinson's, nausea, seizures. It's used as an anti-inflammatory agent and a muscle relaxant. When used in the conjunction of opioids, it can actually reduce the need for opioids. Is there a role of cannabis in medicine? How extensive is that role? What are the limitations? And how do we control the dosage and delivery? All of this needs to be evaluated further in the United States. There's been a lot of research worldwide in countries like Spain, Israel, and the Scandinavian countries, but not in the United States because of the way that cannabis was scheduled. It was scheduled as a type Schedule I agent in the United States, so research could not be done on it. Now, since so many states have legalized cannabis, the medical use of cannabis, and even the recreational use of cannabis, research will grow within the confines of the United States.